move on to Dr. Elvisa Cavallini with carboxytherapy instructions for users.
Sergio dell'invito.
Thank you very much, Sergio, for the invitation. Congratulations for the excellent meeting. And talking about carboxytherapy in 7 minutes is a bit difficult, but I'm going to summarize what we're going to talk about during the next few days, because we're going to talk about carboxytherapy 2 days long with many experts, and I'm going to talk about 2 works about lower limbs, which is probably what is more interesting for this audience. Why is carboxytherapy important in the phlebology ambulatory? Because it acts on the microcirculation. Of course, we do act on the microcirculation today, but we do it in an indirect way. If we change the dynamics of the lower limbs with an approach based on the viruses, of course, we do improve the microcirculation. If we wear compression stockings, of course, it will improve the microcirculation, but this technique acts directly on the microcirculation by acting on the meta-arteries and the capillary sphincters, thus improving one of the main aspects of the microcirculation, which is the vis a tergo. So it increases the flow, the microcirculation flow. Microcirculation is divided and separated from the bigger vessels, from the hormonal system and other systems, but it is mostly regulated by humoral local factors. And the hemodynamic is very important for the microcirculation because it regulates the circulation itself based on specific metabolic needs of the tissue in that very moment. And you see that CO2 is one of the main factors here because it's a regulatory factor for the vasomotion. More specifically, the short-term regulation. Here we've got an example of how laser motion is carried out. The vasomotion is carried out. It's a motion of the arterioles and meta-arterioles, and in carboxytherapy it is actually fostered. With carboxytherapy, you also have a long-term action, as a matter of fact, thanks to neoangiogenesis. So false angiogenesis is an increase in the capillary system, not neocapillaries, but quiescent capillaries. So carboxytherapy increases the blood flow thanks to vasomotion and rehabilitates these capillaries. With carboxytherapy and different applications, with the mediation of paracrine factors, angiogenin and growth factors, you can have a development of the microcirculation through true angiogenesis, but this happens in months and weeks, so a set of treatments. This also has a neurological effect. It changes the capability of erythrocytes, and it is therefore very important. Thanks to the Bohr effect, it moves the curve towards the right, and it enables the tissue to receive more oxygen where it is needed. So actual rehabilitation of the microcirculation is carried out, and when the patients ask me, why are you suggesting me carboxytherapy? Because it's a sort of rehabilitation of the microcirculation. So you can improve the microcirculation where it is more damaged. So we can use this treatment in all of the 7 stages of venous pathologies, so ranging from patients without any visible signs of the pathologies up to the patients with ulcers. But carboxytherapy has also very strong effects in terms of microlymphatic collectors, as we're going to see in another study. And it can also be used for microcirculation problems of the lower limbs, such as panniculopathies, for instance, where the microcirculation is a part of the problem. This therapy was created in the 30s in France as a thermal therapy, contact therapy, but as a matter of fact, we are injecting and subcutaneous tissues, and therefore we have to do it in a laboratory. We've got special devices at present that are very sophisticated and that enable us to dose flows and volumes precisely in order to change and adapt the treatment depending on what we need to achieve with sterile equipment. This is our nurse. We've been making a video. So this is an injection, subcutaneous injection. And if you have a look at the gas injection, you can hear this sound. And the subcutaneous perfusion was being performed. This patient came to us for telangiectasia, and we decided to apply this technique. But we can use this treatment also for lymphedemas. Valeria's group has published this article on lymphedemas, severe lymphedemas. It is a study carried out in 10 applications that demonstrates that with a scintigraphy support, the volume reduction, stasis and symptoms, and the restoring process that you can see. So after 10 days, after 10 applications. So the treatment was carried out with a puncture, a very slow infusion of a big quantity of gas. And in this case, you're not creating any fibrosis. You're not treating a cutaneous pathology. You have to confer as much thickness as possible in order to foster microcirculation. But also for ulcers, this technique is important because in ulcerations, of course, you've got lots of tissue due to an ischemic process, and if you don't reach 30, 40 millimeters of mercury, you can't cure, you can't treat the ulcer. In this case, we've got this laboratory, which is very comfortable for the patient. And for these patients, we've got these values. We've had peripheral arteriopathy or chronic venous insufficiency, and you can see that the percentage of ulcers, if treated together with advanced dressing, advanced treatment with this treatment, you can have these results. And with the Doppler analysis, you can see that. However, the result was very positive. So the conclusion is that the satisfaction of the customers with this treatment is translated in a widespread use of this technique. So we are not replacing any therapy, but we are enriching the existing modern therapies, advanced therapies. I had some clinical cases to show, but actually this is the end of my presentation, 20 seconds before. So thank you very much for your attention.
Thank you very much. We are now continuing with Professor Tomaselli.